Hello and good early morning, Facebook family. It's been a while. My name is Dr. Annette Ansong, and I am your board certified pediatric cardiologist coming to you live on this day. So, how is everyone doing? Like I said, it's been a minute or two, but hopefully you all are doing well, that you're still busy tackling your resolutions and goals that you've made for yourself at the beginning of this year. And if not, guess what? You have tomorrow to start it all up again. There's always tomorrow. So, as you know, part of my New Year's goal was to start these Facebook Lives in an effort to increase heart healthiness in you all, my Facebook family. Because hopefully you know by now, but heart disease is the number one cause of death in men and women worldwide. So today, I wanted to discuss a recent current event, and that is the death surrounding teenage heartthrob Luke Perry. As you know, he died last week at the young age of 52 from a stroke. 52, that's pretty young, especially now that I'm in my 40s. And when situations like that happen, it always makes us think to ourselves, is this something that can happen to me? Am I at risk for a stroke? So hopefully in the next couple of minutes, I clarify some of those questions and concerns. And of course, whether I do or don't, you should always talk to your primary care physician about such health issues or health concerns. So to begin, what is a stroke? So a stroke is any disruption or interruption of blood flow to the brain. Okay. And so when this happens, then it deprives the brain of the oxygen and nutrients that it needs to function properly. And then if that happens, then it causes brain cell death. Then in us, physically, it can cause long-term disabilities or even death. So not good. And there are two types of stroke. There's ischemic and hemorrhagic stroke. So ischemic stroke is when a blood clot blocks the blood flow to the brain. And a hemorrhagic stroke is when one of the blood vessels leading to the brain or in the brain, it ruptures, it bursts. Okay. So that's a huge problem, a huge concern, because of the long-term disabilities that a stroke can cause. So then what are the risk factors for a stroke? So in adults, risk factors are primarily preventable. And they're things that I've talked about actually in the past, such as having high cholesterol. Because when you have high cholesterol, it causes something called atherosclerosis. And atherosclerosis is when the cholesterol mixes with blood and other elements that move along in the blood vessels, and they stick to the blood vessels. And these plaques can then break off and embolize, and that's the medical word for move along into the blood vessels in the brain, and thus cause an interruption or disruption of blood flow to the brain. So that's a risk factor, atherosclerosis or high cholesterol. Another risk factor for stroke is high blood pressure, because when your blood pressure gets really, really high, it weakens the blood vessel walls in the brain and can cause them to rupture, thus leading to a hemorrhagic stroke. Another risk factor in adults for a stroke is having diabetes. As far as risk factors in kids, in babies, fortunately, stroke is rare in children altogether. But in children, risk factors vary. Usually it's not the preventable things that we see in adults. But such risk factors can be events that happen during the time when a mom delivers her baby, and these events can happen before the baby comes out or right after the baby comes out. Other risk factors for children include having congenital heart disease. There's certain congenital heart diseases that make a child prone to stroke. Having blood disorders such as sickle cell disease can make a child more prone to stroke. Trauma to the neck or head can be a risk factor for stroke. Having certain malformed arteries and veins, blood vessels in the brain can make one prone to stroke in kids and adults for that matter. Certain drugs like cocaine can make one prone to stroke in kids, or trauma to the head, a really bad fall can make one at risk for stroke in kids. So what are the signs and symptoms of a stroke? So in babies, it may, especially newborn babies, it may manifest as a seizure, okay? Especially if they've had some type of insult or event during the time of delivery. Another sign in kids may be that they're having feeding issues, okay? And this is not to say that all babies that are having feeding issues may have a stroke, but especially in the newborn babies, if they're having really prolonged issues with not feeding right, not catching on, it's something to consider. In adults, the way of remembering signs and symptoms of stroke is by remembering this acronym called BFAST. So basically, each of the letters, the B, the E, the F, the A, the S, and the T, correlate with a sign of symptom that may indicate that someone is having a stroke. So the B stands for balance. In someone who's having a stroke, you may notice that they all of a sudden have lost their balance. The E stands for eyes. In someone having a stroke, they may complain that they don't see something or see double or have blurry vision. The F stands for facial drooping. In someone having a stroke, you may notice that one side of their face seems to sort of fall, or if they try to smile, it's crooked. The A stands for arm weakness. In someone having a stroke, if you try to hold up their arm, it just falls. They can't catch themselves. Okay. The S stands for slurred speech. Someone who's having a stroke, they may not be able to, enunciate their words properly. It just sounds very slurred and muffled. And then the T stands for time to call 911. Basically, if you see any of the above that I just mentioned, it's time to call 911, because with a stroke, time is brain, meaning the longer and longer these symptoms go on, brain cells could be damaged, they could be dying. So you want to act fast once you recognize these signs and symptoms. So as far as ways of preventing or decreasing your risk factors for a stroke in older kids and adults, it's primarily leading a heart-healthy lifestyle, meaning being aware of your weight, making sure that your weight is within normal limits, that you're maintaining that BMI, that good BMI, that normal BMI, which is 18.5 to 24.9. Making sure that your blood pressure is within normal limits, what it should be. So basically checking in with your primary care physician, making sure that you've checked your sugars, that you're not at risk for diabetes, you're checking your cholesterol, all those things that, I've talked about in the past, and I'm sure hopefully your primary care physician has also discussed with you and your family. So just to recap, as far as the signs and symptoms for a stroke, remember, be fast. B for balance issues in someone having a stroke. E for eyes, they're complaining of double vision, blurry vision. F for facial drooping. A for arm weakness. S for slurred speech, and T, time to call 911 if you see any of the above. So hopefully this has been somewhat informative and helpful. Glad you could spend your time with me. And hopefully I'll see you all sometime soon. Take care. Have a good rest of your work week and a great weekend. Bye, guys.